My name's Kel Myers and welcome to Phoenix Sound. My guest today is Dr. Peters. She joins us to discuss a groundbreaking leap forward in the fight against the elusive disease we call endometriosis. Currently, there are no non-invasive ways to diagnose the disease, and it takes girls and women anything from 4 years to a decade to be diagnosed via the current gold standard, which is laparoscopic surgery. Now, it doesn't take a doctor to see that there's something really flawed with this process that's fraught with misconceptions, myths, and often misdiagnoses. We live inside a healthcare system that is in desperate need of reform, or perhaps even a revolution. Luckily, the tides are turning. Dr. Peters and the clinical research team she leads at Proteomics International, Perth, Australia, are currently developing a way to diagnose endo via a simple blood test. In today's episode, we talk about the significance of what's being hailed by many as a beacon of hope in the fight against endometriosis. We uncover the challenges that have plagued the diagnosis process, the critical need for accessible and affordable healthcare solutions, and what the next 10 years look like for women and girls impacted by this disease. Stay with us. Welcome, Dr. Peters. Thanks for joining me today.
Oh, hi, Kel. Thanks so much for having me.
So, pro-marker endo is being hailed as a significant advancement in the fight against endo. Can you introduce us to this tool and its significance?
Sure. So really excited here at Proteomics International about our development in the endometriosis space. And we know that endometriosis is very complex, affects a lot of women globally, and there's a number of diagnostic challenges. So we really saw that there was a unmet need to do something in this space. And so we started to research using our what's called pro-marker technology. And we had used this technology in the lab previously for diabetic kidney disease. What this tech does is it searches for markers in the blood, which is like a protein fingerprint, and it's unique to particular diseases. So in this case, it's unique to people with endometriosis. And so the idea is that you could have a simple blood test and it would accurately tell you that you have endo or you don't have endo. And our clinical studies have found that we can correctly identify up to 90% of people with endo. So it really is an amazing breakthrough in this area.
The next question I'm really curious about is around innovation versus tradition in terms of medical advancements. And I was wondering how pro-marker endo finds its place within that dynamic. Do you see this as complementary to the traditional diagnostic approach, or is this a gateway to an entirely new way of potentially diagnosing the disease?
That's a great question. And I think initially it is more as a complementary to the traditional techniques, because we need to respect the current diagnostic techniques and appreciate that one test may not necessarily be able to diagnose all types of endometriosis, given how complex it is. You know, there's deep disease, there's more superficial disease, and we know that all the gold standard tests, the laparoscopy and even the newer internal ultrasounds have their limitations. And so what we're hoping to do with our blood test is complement those tests. And what I mean is a doctor or a patient can, if they suspect, look, I might have endometriosis, they can ask their doctor for the test, our blood test, pro-marker endo, or the doctor, if they know about the test, can say, look, there's a new blood test. Let's run this blood test. We can get the result back to you in a week or two, and then we can make a more informed decision as to what to do next. And we might be able to rule out endo, and then the doctor can move on to other, areas that might be causing the symptoms. But if we rule in endo, then the doctor can say, look, let's refer you on to a gynecologist and let's get this diagnostic procedure underway. And that will shorten these incredibly long delays that we're seeing in the diagnostic space in endo. So that's where I think we are complementary to the current techniques. And then over time, I think as this type of innovative test becomes more recognized, I think there may be room to replace some of the current standards.
Moving on to endo care. When it comes to endometriosis care, two of the key concerns for many women seem to be accessibility and affordability. I'm just wondering what measures are being taken to ensure that this blood test would be accessible and affordable for everyone who might need it.
Yes, and so those are two areas that we will be working very hard to ensure that this test is available to everyone. And obviously, one area that we've just talked about is diagnostic issues, the delay in diagnosis, but there's also this accessibility issue and cost issue. And it's particularly important for women in rural areas, regional areas. It's not always easy to just visit a hospital or a specialist. It costs a lot of money. And, the government has been introducing some ideas, such as the new clinics that are rolling out around Australia.
Yeah.
And that's a great start, but that's only 20 clinics. And that's part of the problem is we need to increase the accessibility. We need to reduce the costs. It would be helpful to have a less invasive test, such as just a blood test that really you could have done at any pathology centre. So I think we will be pushing hard to make this blood test affordable and accessible to everyone.
That's really great to hear. Many women do still find themselves unaware that they've even got the disease.
Yeah.
And I'm wondering what steps you and your team might be taking to educate both the public and clinicians around endo, and how important is patient advocacy here?
Yes, I think patient advocacy is huge, but we also need to educate the doctors. And we know from speaking to a number of people around the world that women's symptoms are dismissed, it's just a woman problem, you need to deal with it. There's a feeling of helplessness, frustration, am I just imagining it? Is this actually normal? And, there's only so many hours in a day. You can't keep visiting doctors, and it depends on the type of person you are. And a lady might go to a doctor once and sort of get dismissed and that's it. Okay, we just live with that. And really that's quite unfair. And our role is that A, we want to try and improve the diagnostic avenue, but also B, in presenting our work around the world, what we're hoping to do as well is to increase awareness of the disease. And how might we do that? So in another disease that we're working on, we are doing exactly that, increase awareness of kidney disease in people with diabetes. It's not dissimilar to endo, where people, they have some symptoms or no symptoms, and doctors and patients are sometimes completely unaware that this is something to be taken care of and to be aware of. And so we've been conducting panels where we get experts to talk about, this is the disease, this is the current standard of care, here's a biomarker test, a blood test that could help, how could it help? And really trying to increase awareness across the different spaces.
Yeah.
So it appears that endometriosis needs to be a multi-discussion. So it's not just a woman is talking to their GP and the GP says, yes, you need a gynecologist, because we also need perhaps a sonographer who has the expertise to do the internal ultrasound, because it's not just any old ultrasound. It has to be done very particularly. It's quite difficult. I actually witnessed at a conference some of the complexities of how that ultrasound has to be done, because you can just simply miss endometriosis. And so if endometriosis has spread to other areas, the bladder, the colon, then other specialists have to get involved, because it needs to be sort of as I said, multidisciplinary, and the right action needs to take place. You don't want to be in a situation where you have a laparoscopy and some endometriosis is identified, and then they say, oh, well, actually, we can see it's on the bladder. We need to get a different specialist in because we're not quite the right people to do anything here. So, stitch them up and they have to come back for another surgery. And so we, in our efforts, are trying to reduce that burden and that number of surgeries perhaps that people may have to undergo. So like I said, a triage system, can we rule in endometriosis, meaning you need to have the next steps in the pathway, and perhaps we can guide with further development of our test exactly what that might be. Or actually, we think you should have some imaging done first via ultrasound or some alternatives. And there's lots of movement happening in those in that space in imaging. So I think between all the different techniques, I think there's room for us to do a, far superior job of managing people and making it a more personalized approach, because everybody's quite different. Each person's endometriosis is very different. Severity of symptoms doesn't equal severity of disease.
Yeah.
There's lots of complications. And so while our project started off as a very simple project, we're quickly finding out that there's a lot more involved, and we have some exciting avenues that we're starting to explore. Different types of endometriosis, and are our biomarkers specific for, say, deep disease or ovarian disease, or can we pick up the most common type of endo, which is the superficial disease? So we're starting to sort of explore that now, which is really exciting for us.
That's really exciting. And how far away are you from being able to take something like this to the market and to clinicians?
Yes. So there's a number of steps that normally have to go into bringing a diagnostic test like this to market. And thankfully, we have some experience with our kidney disease test. And so at the moment, we're doing some additional clinical studies to confirm our findings that we've got so far, that yes, these biomarkers are associated with endo. They can differentiate different stages of endo, different types of endo. And if our latest clinical study is a success, which we expect to sort of have the findings released mid this year, we would really hope to bring the test out to the clinic in the next 12 months. And what that looks like in the clinic is obviously governed by a number of regulatory and reimbursement processes, but all of those avenues are being currently explored.
That's so exciting. So not long off at all, which kind of ties into my next question, which obviously there's so much work to be done, but I guess it's a hopeful time because there's so much innovation happening. Could you reflect on how you envision the landscape of endo diagnosis and treatment evolving, say, over the next decade?
Yes, I think we're going to see an explosion in this area, because even from the few conferences and events that I've attended in the last year, buzz was real. And I've worked in diabetes space for a very long time. And so endometriosis was quite new to me. But when I was talking to these specialists and experts from around the world, there's a real unity between all of the people. They're great friends. And the people I'm talking about is across the spectrum. There were gynecologists, there were GPs, there were research scientists, nurses, the whole spectrum. And they're a great bunch of people who I met. And, everybody is actually looking to work together. So we've been having some great conversations at these conferences with lots of people who are saying, hey, would you be interested in working with us? Let's test your new diagnostic test, Promarker Endo, in some of our patients, or have you thought about doing this? And so I think there's a real excitement about where biomarker tests such as ours could go. And we're not alone. There are a number of groups around the world, research groups and companies, that are looking for biomarkers and different ways to help ease this burden of disease. And so I really see that there's going to be opportunities for new tests and tests in specific types of endo, perhaps, new imaging techniques, which I mentioned, and, perhaps even improvements in surgery. And obviously the awareness is the one that's really going to improve. In the last year alone, it has significantly improved. They're getting a lot of celebrities on board, getting people to speak out and make it known that this is quite a common disease. It's 1 in 10, I think, globally, but in fact, that's probably a huge underestimate.
Yeah, definitely. But it's really positive to know that there's such a collective energy around wanting to find a solution and work together. And that's incredibly insightful, I think, for our audience, because it is easy to think that maybe there's quote unquote no hope, or, to be in a state of distress is quite common when you're dealing with these symptoms, or you're seeking a diagnosis and maybe getting brushed off. So I guess that takes me to my next question around what advice would you give someone who's experiencing symptoms, and are there any resources or steps that you particularly recommend they take?
Yes, I would just recommend people seek help. And even if it means you have to go to multiple doctors, and really, just keep pleading your case, because as we move to more awareness, more doctors will be aware of this and you will be heard. You can ask for a referral to a gynecologist. You can search out these new endometriosis specialist centres, or even women's health specialist centres. And if that doesn't work, then there's some fantastic organisations here in Australia, Endometriosis Australia, huge amounts of work in this space. And they have a great website, and, you can go there and get the help that you need. So, it's really about, you've got to advocate for yourself. Unfortunately, we can't rely on a doctor to make that initial diagnosis.
Yeah, and I think that's really powerful that you said there, you will be heard, and to keep that mantra in mind that it might be a long and arduous process and journey to get there, but it will happen.
Yeah.
So, thank you for that. Before we wrap up, are there any final thoughts or messages you'd like to share with our audience around endo or women's health in general?
No, I think just that, this has been an amazing opportunity for our team to be involved in something that even some of our team had never heard of. So, clearly there's a lot for us to do in terms of awareness, and really people shouldn't be suffering from this sort of pain for this amount of time. This test, we really believe can change the lives of millions of women and girls worldwide. As I said, nobody deserves to live with this chronic pain. And really, we want to help women get the answers that they deserve sooner.
Yeah, as they are entitled to. And I definitely do see this as a beacon of light. And thank you for sharing your time and your expertise with us today, Dr. Peters. It's been an absolute pleasure having you on, and your work isn't just inspiring, it's really paving a way for a better understanding around the treatment of endo. So thank you so much for all the work you do, and I'll keep rooting for you and your team, and all the best.
Thank you, and let's chat again soon.
Definitely. You take care.
Okay, you too. Bye.
Thank you. Bye. And that, dear listeners, wraps up a truly enlightening conversation with Dr. Peters today. It's moments like these that remind us of the power of innovation, the importance of advocacy, and the relentless spirit of those seeking to make a difference in the world of endometriosis care. You can find more on Dr. Peters and the clinical trials her and her team are running in the show notes of this episode. And until next time, I'm Kel Myers, and thank you for joining us here on Phoenix Sound.